and we will pass to one of the biggest investors in the Republic of Moldova from the health sector. I'm speaking about Medpark Hospital. Probably for the local community, but I believe that also for the regional one, this is not an unknown name, and I'm giving the floor to the representative of Medpark.
Thank you very much for the opportunity to talk about our experience in national health care sector, first of all. So, why we are here in this panel? Probably because we consume a lot of energy and we do produce medical waste, but still we think that we are on a sustainable growth trend, and we are quite innovative. That's why probably we're here in the panel. So I constructed my 10 minutes, and I will really try to keep to be in 10 minutes. On what I think would be interesting from business perspective, while I am joining some events outside of the country, and what I am interested to hear from the businesses that are operating in the same sector, healthcare sector, that's what I have put in my presentations. And because I prefer to focus on visuals, so I do prepare a couple of slides together with my colleagues, and if technical team will allow us to see them. Visualize, please. So till the technical team will help us with the slides, I will make the introduction. What is Medpark International Hospital and what we do in Republic of Moldova. So we are the first multidisciplinary acute hospital opened in Republic of Moldova, opened in 2011, the first and only foreign investment in healthcare sector. So the majority owner or investor of the hospital is in Turkish construction company, Suma, that is working globally at the moment. So a couple of numbers, because business is about numbers. So first, the size of investment, and the moment of launch of the project, the initial investment was 24 million euro, and it was financed partially by European Bank for Reconstruction and Development. That was the phase one. Now we are in the phase two. We are building the second hospital, so the second facility. It is on the same plant. Actually, it is as big as the first one. We have already 12,000 square meters, and we are building another 11.5. And this is investment of over 15 million euro happening right now. So it will be launched at the end of this year. So total investment of Medpark International Hospital already is coming to 40 million euro, and the hospital or investor is ready for another 10 million, because we need to complete our oncological branch, and we are in discussion for extension of that project as well. So about a little bit more numbers, so just some charts. The figures themselves are not important. The trend is more important. So the below two are showing us the dynamics in outpatient and inpatient department, or to be translated in simple words that everyone is used. The left chart is about consultations that are happening in our polyclinic department. So this year we will come to 160,000 of visits. These are visits for medical consultations. So the right lower chart is about the number of the surgeries and interventional procedures that are happening in our hospital, and this year we will exceed 8,000. And about the number of employees, because each and every business is first of all about people who are building that business. So we started the upper chart is about the staff employed in Medpark International Hospital. We started with 300 employees. And at the moment, we are already 650, and at the end of the next year, we will be over 800 staff members. So this is quite a large team already. Of course, numbers, I'm sorry. Of course, numbers are important in absolute number, but they need to be interpreted, and the context is the most important. So we haven't put in the slides the comparison with the healthcare system of Moldova as a country per total, but we do have comparable numbers or competitive numbers, important numbers at the national level. We put the charts or comparisons only in the private sector of our country. And we can say that in Medpark are happening a quarter of all outpatient visits, of all the consultations in private sector. Actually, the outpatient activity is the simplest medical service. You are opening an office and you are receiving patients for consultations, actually for a talk, and you have a service that is outpatient service. In here we are encountering 25%. About inpatient, we are performing 35% of all the surgeries in private market, and in deliveries we may say that we are quite dominant. We are performing 45% of all the deliveries in private healthcare sector in country. So this is not about Chișinău, about the country. So, each and every organization should be built on some principles, on some pillars, and based on them, you are organizing and reorganizing your internal processes. So what about us? We are a patient-centered hospital, and this is not just a nice saying. This means that we do involve patient in the development of our organization. We do conduct structured feedback analysis according to international rules and protocols that are discussed monthly in our organization. And according to those feedbacks, we are reorganizing internal processes, and actually may say that patient is a stakeholder, one of the most important stakeholders in development of our organization. The second one is we are a pain-free hospital. We do believe, our belief is that hospital, even a surgical hospital, doesn't meant to be painful. And there are plenty of procedures and protocols available nowadays to pass through serious medical procedures without any pain. And we are implementing those protocols. Of course, we are measuring the outcomes and doing corrective measures when it is necessary. The third one pillar of our organization is evidence-based medicine. Actually, medicine, it is more and more, so each decade it is moving from somehow mostly talking to the patient and knowing something, to a real math based on standards, based on figures, on estimations, on prognosis, on percentages. It is not about improvisation, what we see in real world medicine today. That's in each and every medical specialty exists international associations that are releasing each 2-3 years the updated protocols and guidelines according to the clinical studies and according to the evidence that exists. So in medicine you cannot stay in place. You must move forward and you need to learn each day. And this is the fourth pillar of our organization. We are a learning hospital. In a practical matter, what does it mean? It means that we have educational programs. Some of them are internal, some of them are external, but we do have targets, how many hours of education, specific particular education should be achieved in each department and even by each employee. And of course, each year, at the end of the year, we are analyzing realization of those targets. And in hospital, it is not very simple to be eco and to be green still. One, it is about organization of the processes, and when more options are available, we would choose that one that is sustainable and that is protecting our planet, because we do understand that the future is in healthy environment, first of all, and environment is heavily influencing our health. So what are from the charts that you have seen above, we may say that our organization is quite successful. And what are the key of that successful growth and development? So the first and the most important one is the Joint Commission International Accreditation. This is the skeleton of our organization. For those of you that are not from healthcare, of course, this is just a word or just some letters. For those who are operating in healthcare management, it is a gold standard, it is a gold seal, and actually this abbreviation, GCI, is opening, I would say, almost any doors in international medical world. So when you are saying that you are GCI accredited organization, the level of trust to you immediately it is going up. It is the hardest to achieve and the most difficult one standard in healthcare. We were the first and we are still the only organization in this country that is that implemented these standards and is accredited and reaccredited each 3 years, and in the region actually there is only one region, would mean Ukraine and Romania. There is only one other facility in Romania, that's all. So it is tough, difficult to implement and difficult to maintain. There are a lot of surveys, the standards are changing each 3 years, so it is a really a live accreditation system and you need to keep up. Other points that guaranteed us the sustainable growth is extensive collaboration with international individual experts and partnership with leading academic and clinical centers regionally. And plus, we do continuously invest in medical technology. Technology is developing extremely fast. Of course, we cannot catch up and we cannot compare with Central and Northern European countries, and of course not US, but still for regional level we are trying to be in front, and for you to understand, in the latest 2-3 years, around €1 million we are investing in medical technology. This is quite a lot for a small country that is Moldova. And as I told previously, a lot of educational program, internal and external, and we are part of a dual project in the Republic of Moldova, and we do represent a clinical site or development partner for nursing school in Republic of Moldova, and this year we will have third year admission to studies of nurses in at nursing school in dual programs. What about national and regional perspective? Of course, we cannot live separate from national healthcare system. We are integrated part of it. In Moldova, healthcare system is mostly public, and actually only 5% of the services, of all the services, are happening in private sector. And the national healthcare system is operating based on national mandatory national insurance. A national insurance company is buying services from public institutions, and only in those fields where capacities cannot be completed by public institutions, the services will be bought from private ones. Thus, Medpark is a part of the national system for control of cardiac disease, and namely of acute myocardial infarction. So we hope one day we will change our switch of in healthcare, so as a vision of only supporting public facilities, and we will move to selection of the providers based on quality criteria, on safety criteria, and not only based on property. We expect the day to come. The other component of our integration in national system is the fact that we are serving as clinical site for State Medical University and all the nursing schools that are available in Moldova. We are sharing on regular basis from our expertise and our knowledge, because we strongly believe that rising the level of medical knowledge in all healthcare professionals will give important benefit to all the population. And we think we are, and actually the practice is proving it. We are a regional recognized player in healthcare market, so we have frequent visits from regions to see, and actually they are mostly interested about our quality standards and how we put in place all the standards of Joint Commission International. As I mentioned earlier, it is a very difficult task to do. Opportunities for those who would be interested to enter in private healthcare market. So there is a plenty of space, because only 5% of the services are provided in public, in private, all the rest in public. We do have an aging population, and the need in medical service is increasing exponentially from year to year, and we, as a leader in the market, of course, we would welcome any competitor, because competition, first of all, means development and progress. And there is a lot of opportunities for private insurance market that is in a very initial stage in our country at the moment. And a couple of words about the future. Even it would sound a little bit strange, but future of healthcare is digital. And digital is, as in relation with patient, we already see the request of our patients to digitalize the services as much as possible, to go to that concept of hospital in your pocket, to be very accessible through phone to our patients. Another pillar or direction in digitalization of healthcare is implementation of artificial intelligence in routine work. We do already have a lot of softwares on our big devices of artificial intelligence that are helping our physicians to provide proper diagnosis and to help them in daily routine. Another one is molecular diagnosis and precise medicine. Actually, on this week, I joined a congress in Paris for oncology field, and everything in there is about molecular future of medicine. The drug will be adapted to your own genetic code of that disease. Someday, of course, it will come to Moldova as well. It will be a little bit later, probably a decade or more later, but it will come, and this is the future. And the another one field of development is the prevention of diseases, so the focus on prevention, not on treatment, and this prevention would be done through Internet of Things. All of you, of course, already heard about smart homes, but there are already smart baths, smart toilets that do help us in monitoring our health and predicting and preventing some diseases. So the future is the present is nice, but the future is bright and bringing us huge amount of opportunities. We should keep our eyes open and our ideas free to be in that future in pace with leaders. Thank you.